let's chat about urge suppression techniques. Now, urgency and urge incontinence, which is specifically bladder leakage or bladder incontinence, when you get that overwhelmingly strong urge and you cannot make it to the bathroom on time, or perhaps you are standing around the toilet incredibly rushed trying to pull down your pants and you are already peeing. This can be extremely unsettling, very, very scary, very frustrating, and just completely overwhelming if you are currently experiencing this. But the wonderful news is that urgency and urge incontinence can often be so significantly positively impacted by the strategies that we're going to cover today in this video. Obviously, as you are continuing throughout your pelvic health journey, there will be exercises, hands-on techniques, muscle retraining, lifestyle modifications, etc., that are all going to help facilitate you overcoming this urgency and urge incontinence. But once again, the strategies that are talked about in this video today will also be very, very helpful. And I want to say that it may not be all of these strategies that work great for you. It may be just a few key ones, but that is okay. You are going to take the ones that work the best for you and really implement them in consistently into your routine. And oftentimes what is seen with urgency and urge incontinence is that when these strategies are implemented consistently over the span of about 3 to 4 weeks, that is when a significant improvement is typically started to be seen at that point. Now, that is different for everybody, of course. Some people, the first week, the first couple days that they implement these strategies, they notice a significant improvement. Other people, it does take a little bit longer. Obviously, there are a lot of different factors that can play into this. Clearly, if there has been situations in the past where maybe you've had an accident or maybe you've had a complete bladder loss, that can be very, very scary and cause and provoke a lot of anxiety, fear, worry about bladder control, understandably so. But these are all different things that can help just reduce and calm down the bladder urge at that time and help you have control over your bladder instead of your bladder having control over you. So let's get into it. Urge suppression techniques. First things first, whatever you're doing, when that strong, overwhelming urge hits you, you want to pause what you're doing. So let's say you are washing dishes and the sound of the water is getting to you, or maybe you're finishing up a work meeting and you know you only have 5 minutes or not even 2 minutes to get to the bathroom and back before your next meeting. Whatever it is, take a moment and just pause, try to center yourself, and then you're going to continue on to your way to the restroom, and we'll talk about what that looks like. First things first, pause what you're doing. Then you're going to take some gentle, deep diaphragmatic breaths. Now, the difference with diaphragmatic breaths is that it is not a lot of this upper, like chest and shoulder and neck movement where you're just, like that, and then you're just causing all this tension up in your upper traps, and your neck muscles are turning on and your chest is moving like crazy. That's not the type of diaphragmatic breathing that I would like for you to do. What you really want to think about, keep everything up here relaxed. Can you think about breathing down into your chest, or I should say inside your trunk, your rib cages? Can they expand from side to side? Can you fill up a little bit of the tummy with air? Can you think about even your back expanding, so the back side of your body can expand with air as well? Think about 360-degree breathing. So first things first, pause what you're doing, take some deep diaphragmatic breaths. What that looks like is this. So I typically recommend a few of these. Then what you're going to do from there are several strategies that you can do as you are calmly making your way to the bathroom. Oftentimes what is seen is a mad dash to the bathroom, and that can actually, the quick movements and your brain knowing that you're rushing to the restroom can often trigger your bladder to contract, your pelvic floor muscles to let go and relax, and this is what creates the leakage situation where the urine is coming out. So what we want to do is that as we are calmly walking to the restroom, you can implement these other strategies in. So oftentimes what is recommended, count backwards in your head. This can be anything from 100 down to 90 or down to 80, whatever it is, however long it takes you to get to the restroom. You can do from 10 to 1. You're going to calmly just think about what's happening with the numbers in your head. Other strategies that can be very helpful are, let's say that if you have a chance, you can take your fingers, interlock them like so. You are going to take your hands and take your palms and stretch away from your body. So you're really going to stretch the webbing of your fingers. This can often be enough of a distraction that it takes your brain away from what's happening with your bladder and your pelvic floor, and it can curb and calm down the urge. Other things that can be very helpful as well are calf raises or heel raises. So let's say you're standing before maybe you make your way to the bathroom, or maybe you've reached the bathroom and you still need to calm down the urge. Stand, and then you're going to lift up on tiptoes, lifting the heels off of the ground, rest back down. You can do that about 10 or so reps. Other things that you can do as well, remember you don't have to do all of these, but other things you can do as well are what we call quick flicks or strong, fast Kegels, so muscle contractions of your pelvic floor muscle contractions. I typically recommend 3 to 5, you can do 5 to 7, there's no magic number, but you want to do enough that you're squeezing hard, you're letting go, squeezing hard, letting go. You're doing this successively. What this will do, there's several reflex loops that work between your brain, your spinal cord, your bladder, your spinal cord, and your brain. Oftentimes what happens with urgency and urge incontinence is that these reflexes are not being interrupted, and so your body's natural process of just letting everything go to pee is not being interrupted. So we want to interrupt that cycle. So one way we can do this is through the quick flick. So if we get the pelvic floor really turned on and engaged, relax and then repeat a few times, this can often be enough of a signal to the bladder to say, whoa, bladder, you need to relax and chill out. And that will calm down the urge. And so it will buy you time to make it to the restroom so that you don't end up leaking on yourself. Those are the main strategies that can be so beneficial for urge incontinence and urgency in general. Obviously, as mentioned before, as you are on this pelvic health journey, there's going to be other things that are put into place, oftentimes manual therapy, hands-on therapy, different techniques that you can do or the therapist can do for you or with you. There's going to be different exercises. There's going to be talk about what are you drinking, what are the triggers maybe for your bladder. Is it every time you hear the sound of running water? Is it when you put your key in the door when you're getting home from work or from grocery shopping? There are lots of different things that we can talk about and implement in, but these specific urge suppression techniques can also be very helpful. Remember that if you're just starting out on this journey, sometimes it can take a few weeks to notice an improvement, but don't give up, be consistent, and you really should notice that your symptoms are becoming more manageable and under control, and eventually we want to get you to the point where you're not having to worry about this at all and you have full, complete control of your bladder and you're not worried about anything. All right, take care, and if you have questions, please let us know.